Morning, everyone. We'll just let everybody filter in and then we'll get started shortly. Thank you. Okay, good morning, everyone. You're very welcome to this morning's event, Migration, Mental Health and Resilience. And this is a meeting of the Women's Mental Health Network. So my name is Faye White and I'm the Women's Health Officer at the National Women's Council. And together with my colleague Alana and Ryan here in the National Women's Council, we co-convene this network with our colleagues Louise O'Leary and Elaine Donnelly in St. Patrick's Mental Health Services. So if you are new to the network, if you're not a member, the network is for people and organizations with a committed interest in women's mental health issues. So our aims for the network are to share information and promote networking amongst professionals and advance interdisciplinary and multi-agency collaboration in women's mental health issues. So we do this through webinars such as this, also by sharing newsletters, and we have a LinkedIn group for members as well, where you can share resources, services, or any emerging research, including your own. So I'll shortly hand over to my colleague Louise, who will introduce our wonderful speakers and moderate our discussion today. But firstly, I'll just give a bit of an overview of the topic at hand today and the plan for the event. So we already know that women have very distinct experiences of their mental health and experiences of mental health services. And there's a lot of factors that can compound this for migrant women and asylum seeking women. We know that isolation and not having a support network or family support can be a particular issue for a lot of migrant women and asylum seeking women. And this can contribute to poor mental health. And a lot of migrant women and asylum seeking women also face additional barriers with accessing services and continued use of services. So we'll hear more about that in depth from our speakers today. In addition, perinatal mental health is a growing public health concern for women, and recent research in Ireland has shown that migrant women are particularly at risk of experiencing mental health problems in the perinatal period. So that's during pregnancy or in the first year after birth. We're conscious that we do not have a speaker today to speak specifically about the experience of Ukrainian refugees or Ukrainian women arriving to Ireland. We know that the majority of Ukrainian refugees arriving to Ireland are women and children. So we will be providing some resources and signposting to services in our newsletter that will follow this webinar up, which will go out next week. So if you're not a member of the network, I'll be sending out an email after this, and you can sign up if you'd like to receive that newsletter. So just some housekeeping bits. If you'd like to turn on the closed captions, that should be available at the bottom of your screen, the little CC button. The Q&A is open. Please do add any questions. We'll be having a panel discussion at the end of the event, and we would love to hear your questions, as well as that if there's any resources you want to share, any services, we would love to, if you would pop them in the Q&A box as well. And just to let you know, after our speakers, we'll have a 5-minute comfort break just to go get a cup of tea or coffee or whatever, and then we'll come back for the panel discussion. So that's enough for me. So I'll just pass over to Louise O'Leary, who's the Advocacy Manager in St. Patrick's Mental Health Services.
Thanks, Faye, and good morning, everyone. You're very welcome from wherever you're joining us in Ireland or beyond. We're delighted to have you here with us today to speak to this important topic. And we're especially delighted to be joined by our expert panel, Liliana Morales, Dr. Caroline Munie, Grogan, and Justyna Maslanka. So just one thing, so what we're going to do is we're going to start with 3 of the speakers, then take a break, and then Justyna will join us after the break. So we will get started, and we're going to start with Liliana Morales. So I'll ask Liliana to unmute and share her camera. So I'd like to very warmly welcome Liliana. Liliana works as a psychologist with the HSE Psychology Service for Refugees and Asylum Seekers, primarily working in the Bailseskin Reception Centre. Liliana has 17 years experience working therapeutically with asylum seekers and refugees in Ireland. She's also involved in cultural competence or cultural humility training for doctoral psychology trainees, and has a passion for culturally inclusive practice, social justice issues, and diversity within psychology. Liliana has been especially generous to the Women's Mental Health Network, having previously spoken at a webinar we held in summer of 2020, which focused on unpacking the impacts of COVID-19 pandemic on women, where she highlighted the particular implications and challenges facing women at that time living in reception centres and under direct provision. So Liliana, I should really say welcome back to you this morning, and thank you so much for being here today. To get us started, can you explain a bit about your role in the Psychology Service for Refugees and Asylum Seekers?
Well, thank you very much, Louise, for the introduction, for the invitation. I'm delighted to be here. So yeah, like you said, I work for the HSE in the Service for Refugees and Asylum Seekers. So we are mostly based in the National Reception Centre in Bailseskin, and we also work in a health center in Dublin. So we work with adults and children. I specifically work with adults, and we do we offer individual therapy, or more recently, over the last couple of years, we also are offering groups, and these are kind of skill-based groups. So we're offering trauma groups and well-being and resilience groups, both in English and in different languages as well. So far we have offered groups in Arabic and Somali, and they have been very, very well received. And we are located in CH09 in Ireland. So in the HSE organization, this is Dublin North City. So the people we work with live in Dublin North City.
Thanks. That's a lot of different components of work you mentioned there. Did you say, sorry, a trauma group and a wellbeing and resilience group as well?
Yes.
Okay.
Yes.
Yeah. Okay. So that, because I know that's something we might come back to. That's really interesting. And from your experience, what are there common mental health concerns or themes that come up for the women you work with?
Yeah. Well, first of all, when you talk about an asylum seeker or refugee, those terms are legal terms. Mm-hmm. So these are not psychological terms, but they have an impact on how people experience the whole process of being, having to leave their country and seeking asylum in Ireland. So first of all, we are very aware that people come with a lot of difficulties from the countries of origin. They wouldn't have left home if there was something not pushing them to leave. So they are forcibly displaced, or if you like, involuntarily dislocated. So losing home is a very, very big theme when you work with asylum seekers and refugees, and loss in general, and a loss of the totality of the life you had back home, of your status, the culture, the language, the connections, you talk about networks. When people come here, they don't know anyone, and all of that. Now, then is the journey, and there are also impacts on the journey. And we're seeing people that are having really, really very difficult and dangerous journeys. We saw in 2015, and still people, for example, that come from sub-Saharan Africa, and they end up crossing the Mediterranean. So not only that's very dangerous, but they witness a lot of things there. So that also has an impact on people's mental health. And we also have to talk about what happens here while they are in the asylum process. So they experience sometimes discrimination, isolation, and are very worried about their families. So sometimes women are able to bring their children, for example, with them, but the partners stay behind, or the extended family stay behind. So there is a lot of worry about them. Sometimes they're lucky, they can contact them, sometimes they can't, and people are in hiding. or sometimes the woman come here by herself, and the children are left in the care of, friends or relatives. And that brings like a sense of guilt as well, because they are objectively safe, but they don't know about the family. And there's this pervasive fear always of being sent back to where they came from, because they are not safe there. So this say in the therapy room, this presents with as anxiety, as low mood. People have issues with sleeping, with trusting other people. There's this sometimes feelings of helplessness, hopelessness, feeling and really being marginalized. That is a big issue as well. And again, these worries, about being sent back home.
Okay, so a huge range of really complex and challenging issues being experienced by women. So on the kind of journey, the migration journey, but then also the kind of challenges around loss, and also kind of maybe barriers, societal or system barriers that women are experiencing when they arrive here as well. So a huge range of.
Yeah, because we are shown only images of a part of that experience. So we see the people, hanging on to their life to the plane, taking off from Afghanistan, or we see the people arriving with their life in a suitcase, and we're left with that. But there's a lot of stuff that happened before they had to make the decision to leave, and there's a lot of stuff that happens here. So they have to deal with it, trying to fit in, navigate a system they don't understand, either because it's complicated or because, on top of that, they might not have the language, and also they have to deal with the situation back home and with the issues that prompt them to leave.
Yeah. And that actually, one of the comments you made there about navigating systems leads me on to my next question, which is about I guess access or potential barriers that people attending today could benefit from being aware of. So barriers that maybe face asylum seeking women who are wanting to access mental health services. Would you have any thoughts on that, sort of beyond your own service even potentially?
In my service, it's kind of different because Valsescan, the health center where I work, is on the site. So the women are coming to the health center across the road. But even then, a big challenge there is childcare.
Okay.
So sometimes women, with small children, don't have somebody to leave the children with. Or if they're sending them to the nearest village, to the school or the creche or whatever, there's all this time coming and going, which doesn't facilitate them accessing the service. We do the very best to try them to, access, but it's not appropriate to bring a 2- and 3-year-old to come to a session when you're going to talk about very difficult situations. So we do our best, but childcare is in general a big challenge for women. Another challenge outside of MAT service is accessing interpreters. So sometimes there are policies and there's an understanding that if we want people to have an equity of access to mental health services, they must have an interpreter. But that's kind of, it happens in some places and it doesn't happen in other places. So that is a big deal for women seeking asylum. Also, like I was saying before, isolation. Mm-hmm. So when you are accommodated in a place that is kind of semi-rural and to go to the psychologist or any other service, you have to get on a bus and go 2 towns over. It is easier if you're a local and you have a car and you know what's going on. But if you live on a certain amount of money and the public transport is difficult to access, and say you have your kids and you have to pick them up and drop them off, that is also a difficulty. There is no equity of access there when we talk about women that are in the rural areas, and that's also for Irish women that don't have the services there. Also, I would say there's a lot of stigma In other cultures, accessing psychology and mental health services is seen as, you know, if you are doing that, it's because you are crazy or you're mad, or that kind of language is used. So sometimes women may take longer to access the service until they understand what is going on and what they are about. When they understand that they won't be judged, and there'll be empathy and compassion when they arrive. And I'd say the last one, but it's not the least important, is sometimes people working in these services do not have knowledge of these people, these population circumstance. So I need to mention later then that what we need to do about that. And I think Barry is going to talk about that when she's going to talk about the cultural competence toolkit. There is a very big component of training and education for us as mental health providers.
Yeah, that's a key point, I think, we'll be coming back to. And as you mentioned, mental health reform have a cultural competence toolkit, and I know AkiDwA do as well. So I'll hopefully Dr. Munyi will be able to speak to that too. Thanks for that. So a lot of practical and logistical challenges for people to be aware of, but then also more nuanced issues around stigma and understandings around mental health, etc. So then my last question to you is, I'm conscious there may be people joining today who are not necessarily providing direct mental health support, but are working with women who are seeking asylum. How would you think they can become more inclusive and responsive to the distinct mental health needs of women?
I think it's very important that we consider the many contexts of these situations. So when you're working with somebody that's seeking asylum or is a refugee, you need to consider their psychosocial context, their cultural context, their political context, what brought them here, because that impacts on the work you do, that impacts on your own practice. And also, it is very important that we know the system. So if we're working with asylum seekers and refugees, we need to understand what is the international protection system like. We need to know that they write this very long questionnaire that could be triggering and re-traumatizing. We need to know that they go to this very long interview, they wait a long time for decisions. All of that, again, impacts on their mental health. So you're not only working with the asylum seeking woman, but that woman is in a complex. So when we focus only on one thing, I think we sometimes lose complexity, and there is a lot there to learn and to know about. And in that way, we need to recognize as well that those systems that they're coming from, and this system has again an impact on their mental health, on their inclusion or their discrimination or inclusion or exclusion. So they are not there just sending appointments and they're not attending, and it's not because they don't want to attend. They probably want to attend, but they didn't. It was at the inappropriate time, or you send an appointment in a different language to English. So we need to be a little bit more flexible and think a little bit more about how we can facilitate this population coming to our services. And again, I think going to talking about cultural humility and cultural competence, we need these spaces. We need education, we need training, we need to be aware of our own cultural background as practitioners. We need to be aware of our biases, because we have them, we're human beings, of our own prejudice, and then we can work with people. Because I know recently with the huge surge of Ukrainian refugees in Ireland, there is a lot of training about trauma, which is fantastic. We're getting upskilled, and that is very good. But we also need these spaces to understand, why are people here? Why and how is it that they turned up here? And how do I feel working with this population? What does it move in me? You know, when you're a psychologist, you also have, in our training, we receive therapy for ourselves. And I think that's very important. And I am aware not every other discipline has that, but we need a space where we can reflect how, because this work impacts on us as well. And I think we need to be aware of that.
Absolutely. a wealth of information and food for thought there. And I imagine we'll be revisiting a lot of those themes that you brought up with the other speakers. For the moment, I will thank you so much for starting us off, and you can take a seat back now, mute and turn off your camera, and we'll come back then for a group discussion after the break. So thanks so much, Liliana, for getting us started. And I'm going to move on now to our next speaker, Dr. Caroline Munie, and I'll invite you to unmute yourself and turn on your camera. So many thanks to Dr. Munyi for joining us this morning. Dr. Munyi works as the Migrant Women's Health Coordinator with AkiDwA. AkiDwA is short for AkiDwA Africa, which means sisterhood in Swahili. And for anyone unfamiliar, AkiDwA is a national network of migrant women living in Ireland. Dr. Munyi has more than 15 years experience of working on integrated health programs for women in rural Kenya and Uganda. And she has worked with AkiDwA since 2009 on a variety of health-related projects. She has a master's degree in philosophy and a PhD in international peace studies from Trinity College, as well as a BA in development studies. So we're very grateful for your time this morning. I know you've had a very busy couple of weeks, so we're really grateful for you making the time to join us. So to get us started, can you tell us a little bit about the work that AkiDwA does and your role there as well?
Thank you very much, Louise. I'm the Migrant Women's Health Coordinator for AkiDwA. And as the Migrant Women's Health Coordinator, we deal with a lot of issues. And I'm sure everyone who is here, they already know that AkiDwA is known for female genital mutilation, because that is the main issue which AkiDwA brought to the Irish consciousness as something which is happening here. However, coming back to the topic at hand, we all know that, or maybe I can state that FGM is as a huge, it's an underlying cause for poor mental health outcomes among migrant women, among other things. And so I want to say that we try to look at these issues in a very, very holistic manner, and the root causes and all of that, and to make this space a place where women coming from diverse backgrounds, from different cultures, where they can feel that they are really, really, really safe to come and speak about their issues. And yeah, so like AkiDwA, we are busy. We are ever so busy dealing with women coming from diverse backgrounds, and again, and with that also comes with a lot of other layers of which we try as much as we can to unpack. Thank you.
Thanks for that explainer, Dr. Munyi. Yeah, so again, that holistic sense of understanding the challenges which may be as serious as having experienced FGM, as well as the different contexts. So that idea of understanding someone's broader context of their experiences and their background, again, really key. So I know in AkiDwA's work on health, mental health is a priority, and you've carried out research on migrant women's health and access to health services in Ireland. And I think that the Let's Talk report from 2020, I think that was one of the last events certainly I was at in person before the outbreak of the pandemic. Can you share some of the key findings from the research and work on mental health that AkiDwA has done?
Yes, I'll share some of the key findings, and thank you so much for bringing up our Let's Talk research, which was done in 2019, towards the end of 2019, and we launched it in 2020 January, just before the lockdowns. And I know there are a lot of things which came up during the lockdown. People saying talking about their mental health. I don't know all that, which was all good. But I want to say that AkiDwA, we were already dealing with it. And thank you so much, Louise, for recognizing that. And actually, let me start like one of the main outcomes, and I think that is key and very, very relevant to this today's event today, is even just the word mental health. That word alone, it came out as very, very stigmatizing, and something which even as guys here, we know that when a woman comes here, let's say, for example, I know what Liliana said was very good, but I also want to add that someone doesn't have a home, someone is living in a DP, maybe with children, with her husband, and they are sharing a small room. Seriously, even without asking someone like, how is your mental health? You already know that this person's mental health is not like the way it should be. So that is why, as we do not use the word mental health, no matter how bad the situation is. And why don't we do this? I'll go back again to what Liliana said. It's because of stigma. Where most of these women come from, they do not have what we may call a structured manner of discussing mental health. Sometimes a woman will just be walking, maybe in the shopping center, you meet your friend, and then you just stand by the side of the street, and then you're like, oh my God, what's going on with my husband nowadays? And they chat, and then they're like, oh yeah, let's have a coffee or tea, and they get into a small hotel or restaurant in the village, they have a cup of tea, chatting, and that woman who is on the other side of experience what she's experiencing, having talked to her friend, that's good enough, because there's no place like therapy. But you'll hear that, and it's something that I used to hear even from my mother, like, I like talking to so and so, she's so good, she knows how to listen, because that is what they're used to. And then you come here, but nobody can tell these women, or my mothers, my grandmother, her friends, that it's just mental, because now that word alone, because you call it ngoma means madness, nobody can tell them that that is mental health. You need to talk to somebody, because they're already talking to other people, and that's good enough. So when we say people come with their own cultures and outlooks and everything, it's also about that if I have a problem which is really, really sitting on me, I just need to talk to somebody. And that's why we call it Let's Talk. And that is and that is our campaign has become very, very popular. And women come here seriously just to talk, but we avoid using the word mental health. Maybe in that journey, and this is coming again from our research, we'll chat, and then we agree, maybe would you like to talk to somebody? And someone might say, and who is that? And then maybe you can also open up, maybe as Liliana said about yourself, that even sometimes I come across things and I need to chat with somebody else, because even us guys here at AkiDwA, we have that counseling which is triggered for us. And sometimes, yeah, and then someone will be like, okay, and then we tell them about the cultural competence. Now that's the other bit, and that they'll go somewhere where there will be culturally competent therapists, and that's now we are sending our women to the Black therapists of Ireland, and these women are the therapists are all over Ireland, and they have a way of matching a client with a therapist depending on the culture and the issues which a woman is undergoing. So now that was the other issue of cultural competence, and so now you can see like that journey, and then and again also I know and then self-awareness also, that is key. Self-awareness, again, that this has been said, that also came from our research as a key finding, that we need to be very, very self-aware about our own conscious and unconscious bias, and because we are all learning, we cannot claim that to be complete, that this is me, Caroline, because I offer cultural competence training, that I know everything. Even just getting to that stage of saying that you have reached cultural humility, for us it is a journey during the training process. And again, being culturally competent does not mean I know everything. It also means saying, now this is beyond me, I do not know this, and maybe I need to talk to so and so on how to help this person. And I'm sure someone sitting opposite you in the room, even just admitting that I'm not able to do this, seriously, someone will feel very, very, very supported, because we also look at the principles of do no harm. Sometimes it's going to do nothing, rather than do the wrong thing. Other times, when it also comes like that, you have to do something instead of doing nothing. So it's a very tough, and it's a balancing act. So you can see that that research was very, very important, and Louise and everyone who's here this morning, and I thank you for asking for that, and I know the other recommendations which I might touch on as we go on. Thank you.
Thanks so much. I love this phrase, cultural humility, which I hadn't been familiar with before yourself and Liliana brought it to the fore. And it makes so much sense, that piece about not presuming as a health professional that your knowledge is sufficient, or that you know everything, and that's okay to say that. And also so interesting about the use of the language we use, even just the term mental health. So let's talk. I'll have to remember that as as an alternative. And I know I think it's important as well, and something that the Let's Talk report raised was, that mental health problems aren't necessarily definitely going to be a consequence or an outcome for migrant women, despite maybe the challenges we've talked about. They're not an inevitable outcome. And I know the Let's Talk report highlighted that well-being is also shaped by resilience factors. So some of the things you mentioned there, the support network, etc. So I was wondering if from your perspective, from your members' perspective in AkiDwA, is there particularly common themes when it comes to resilience and what's most important to support their mental health?
Yeah, there's some common themes when it comes to supporting women. And again, as I've said, you'll see that now coming again from the language and also expectations and the journey itself. What were those push factors and the pull factors? We look at that a lot. And again, like one thing we don't forget at any given time is again about that language. Like, what are the women expecting when women come to us for supports? Like what we call wrap around supports. Even how do we refer them to other organizations? What steps do we take? What language do we use? And who is receiving them? How are they going to be handled at that level when they go to seek those other supports? And what can we do as AkiDwA to help these women, especially navigate the system so that they can feel supported, even elsewhere, not just here in the office, and even when our staff go out there to the shelf, to the DPs. So, like, some of the common themes which we see sometimes is sometimes like the delays which women maybe complain because they come here and they're really, really pushed and they're like, yes, I was expecting this to happen at this time, and this is not happening for me and my children. And actually, during COVID, this was very, very common. Like, women not having the much needed infrastructure in where they were living to help their children with home study, for example, and homeschooling. And those were just not small things. I'm sorry for using that word. That was just maybe not having a smartphone or a tablet or a laptop, and that was huge. And that time a woman is saying, the teachers are on my case because we have not submitted this, the child is lagging behind. And so I like saying that right now we have a generation of children who we don't know how they are ever going to catch up with the others in the general population because they didn't have that. So like the immediacy, like how quickly are some of the issues being sorted? Who can we approach? And when we hit a brick wall, that is huge. And also other issues, like when women have issues and mental health, and then you can see the other layers, maybe they are connected to their physical health, maybe in maternity settings, and a woman is going there, and we are trying to say, like, we need to deal with this at this time, and maybe probably in this manner up to where we can with our expertise. And things are not moving quickly enough. Again, for us, sometimes it's also about that lack of that speed. But when we hear maybe about the news, which is what's happening in the general population, we always know that sometimes the migrant woman is always at the bottom of the heap, and so there's all that. Thank you.
Okay, so factors that can support resilience then would be sort of timeliness to supports, and also again that theme around the practicalities and the kind of logistics of childcare and managing daily roles as a woman. When that's facilitated and resources are accessible, it can be supportive of mental health. But then the opposite's true when there's delays and challenges. That makes a lot of sense. So then I know you've covered a lot of things already in what you've shared about that will be relevant for to help people working in mental health services become more inclusive and responsive to the needs of migrant women. But what if there was one thing you were going to say is the most important thing that people can do or become more aware of, people who are working in mental health services, to become more inclusive and responsive to migrant women's needs, what would that be?
Yeah, this has been said and it cannot be said enough this morning. It's cultural competence, being culturally competent, and just going back to what I've said before, it's about being self-aware, and like that's a huge theme. And going through that process until you become humble to other people, and to be open to learn all the time, and never to say that now I am an expert, I am culturally competent. That's not what it is. And so I want to say that being culturally competent for people offering services, mental health services, to people who are vulnerable, especially migrants, I think that will be that's a huge that's a big thing which can make a lot of difference.
Yeah, absolutely. Thank you so much. And that's very smoothly going to lead us on to Grogan and mental health reform, who's going to talk about different resources mental health reform have developed. So thank you so much, Dr. Munyi. We'll come back to you at the panel discussion as well then. And just to mention, some of the resources we've mentioned already will be shared in the newsletter for the Women's Mental Health Network, but we may as well be able to share some of the things mentioned in the Q&A boxes as well. So Burr, you're very welcome. Thank you so much for joining us. I know Burr is out and about today, so we're
fancy Buzzwells.
So we're extra grateful for you carving out time for us. So to introduce Burr, Grogan joined Mental Health Reform in August 2021 as Policy and Advocacy Coordinator. Before that, Burr worked in the Dáil as a parliamentary assistant, starting with an independent deputy and opposition benches, and then also as a director of elections in 2016. Prior to working in the Dáil, Burr has worked in areas such as homelessness, community development, and reintegration supports for people leaving prison. And in her spare time, Burr coordinates volunteer activities such as Christmas food, hamper events, and local community organising. Burr has worked with and advocated for people with mental health difficulties for many years. And a quick mention for something that Burr and the team at Mental Health Reform are working hard on at present is their Budget 2023 campaign, which people can learn more about and find out how to support at mentalhealthreform.ie. And I know the needs of people from ethnic minority communities are mentioned in there as well. So thanks so much, Burr, for joining us. And to get us started, can you tell us, for anyone who might be unfamiliar, can you tell us a little bit about the work of mental health reform?
Absolutely. And first of all, what an excellent segue from Dr. Munyi talking about cultural competence. And also, just to start, I'm probably going to butcher this, so apologies, but I'm going to say Dia Gwich, Buenos Dias, Bon Dia, Dzień Dobry, Dobro Ranku. And they're the only ones that I had time to practice this morning. I was Googling how to say good morning in loads of different languages. So I'm not sure who's, yes. And I apologies if I have made an absolute mess of them. And the other thing that I'd like to start off by saying is I'm obviously a white Irish settled woman, and I'm coming at this from the perspective of policy and research manager with mental health reform. So I'm very conscious that, you know, I'm not speaking about any sort of personal experiences, and I'm taking what I tell you guys today from the work that we've done in policy and research. And our work is enriched by organisations like AkiDwA and Cairde and Cork Migrant Centre and people with lived experience of these issues, you know, so I'm very conscious of that, sitting here with my big Dublin accent. And the other thing just to say is some of the things that I might bring up could be triggering or upsetting to people. It's really interesting to hear Dr. Munyi say about using language or in let's talk instead of mental health. So just to say as well that, you know, there are supports available to people. So just if there is anything that I say, feel free to mute me.
We'll share support information as well as we go on in the Q&A and on the slides as well. Thanks so much for raising that.
No, I just realized because yesterday I should have a walking like trigger warning beside my head. But basically, so Mental Health Reform, we're the national coalition, the leading national coalition in Ireland for mental health. We have 81 member organisations across the spectrum of mental health services. And as I mentioned, we're delighted to have AkiDwA and Cairde are two of our members. We work with Bernardo's, St. Pat's, National Women's Council, Children's Rights Alliance. So it's a broad range of people coming together for the reform of the Mental Health Act and for better mental health services in the communities that people need. So we're a unified voice, or we try to be a unified voice to government, and we do a lot of policy research and innovation. And as you said, thanks for saying that as well, mentalhealthreform.ie is our website for more information.
Thanks so much, Ber. And I know some of the things you've been working on in recent years in mental health reform have focused on trying to improve mental health services responses to diverse needs of service users, including revised guidelines for working with people from ethnic minority communities, and also a really great cultural competency toolkit, which you launched last year. Can you tell us a bit more about these two particular resources for people who are tuning in today?
Yes. I'd be delighted to, Louise, delighted. So I got so into everything when I was prepping for this morning. Like, there's so much out there. It's really, really interesting. And I suppose part of what mental health reform has done is we did the ethnic minority guidelines, which are guidelines by the Mental Health Commission. So the Mental Health Commission is the regulatory body in Ireland. That's the man who brings me my fresh cups of tea. They're so lovely here at Buzzwells. The Mental Health Commission are the regulatory body, and they have, the quality framework, and they do inspections on inpatient places where you might be accessing mental health services. So they have ethnic minority guidelines for people working in the services, and we worked with them on them because I think it was 2014 we did our own research piece on ethnic minorities and access to mental health services and supports. And we did the first guidelines in 2016, and then they were reviewed last year. And out of that, another piece of work that we were doing was the Cultural Competency Toolkit, which was funded by the Care Integration Fund. I know we hear a lot about Care, but it was one of those really great projects that came out of that. And I have our little toolkit here. And it's really interesting because everything we've been talking about so far this morning, Caroline, Liliana, and yourself and Faye, it's respect, communication, access to interpreters, translators, families and advocate support, and training for mental health staff, and evaluation. So the toolkit that we have, there's tips, there's resources, but obviously that was informed by, there was a high level steering group that was informed by people working in the area, people living the reality of being a person seeking asylum or a migrant person here in Ireland accessing mental health services. So it's really user friendly. It was written in as much kind of plain English as it could be, and it was a pilot project that was done with the Cairde community mental health team. And Justyna, who's going to be speaking to us later, she was involved in our launch last year as well. And on our website, we do have a piece. There's the video, there's the toolkit, there's also like a one-pager. But it's really about, there's so much work done around ethnic minorities and access to services and the things that we can do, that now it's a point of like, okay, well, let's implement all of these pieces, and I think what we've seen with the Ukrainian war and crisis, the war in Ukraine and the influx of refugees, is it's become at the forefront of people's minds, and particularly government and policymakers. There has been a lot of conversation around cultural competencies and access to interpreters, access to different language services. So which is, it's been a really important conversation, but at the same time, we know there have been people living in direct provision or been accommodated in direct provision for many, many years, and people trying to access services for many, many years. So what we've been doing throughout our conversations is this isn't one type of refugee versus another. Everyone should have access to the cultural competent services that they need. So there's loads of bits in it, but one of the things I wanted to say to you was, you know, like our work is great. Like, in fairness, there's loads of really good research pieces on mental health reform, but I was reading this again and it feels like so long ago, but it was only the end of last year. And I was like, God, it's so practical, just really clear, really practical. And a lot of it comes down to just being human and being kind and being empathetic, and like that, respecting where someone, you know, what they've come from, you know, that point of they've left home for a reason, you know. And there's you can use the acronym or the word diverse, and it's D, demographics, I, ideas, V, views, E, expectation, R, religion, S, speech, and E, environment. So it's you know, I can't remember what they're called when you have like the little poem things to remember stuff. You know what I mean?
I do. I can't remember the word. I was going to say mnemonic, but that's definitely not the right word.
No, that's what I was thinking as well. But you know, so you can just, if you're a mental health practitioner, or you're working with people either in a voluntary community organization or anywhere where you're working with people who want to talk, as Caroline said, you can just have that in your head of diverse. You know, we are all diverse. All of our experiences are individual, and to think of the person, meeting the person where they're at, and not having kind of preconceived ideas about how somebody should act, because it's how you're used to your cultural circles acting. So even down to things like eye contact, you know, like in Ireland, we can love sitting down and have a cup of tea and staring deeply into someone's soul. Whereas in some other countries, if you are with a doctor or someone, it can be seen as disrespectful to be looking them in the eye. Touch, you know, body language, handshakes, all of those kind of things. Like it's about shedding any sort of expectations of what somebody should behave like because of, and in fairness, I think we can say that across the board in all of our mental health services and supports, because we don't know what anyone has experienced before. So I think, you know, down to those pieces of just meeting the person where they're at. And I think it was Caroline that said it there as well, is, you know, you're never going to be fully culturally competent, because, you know, there's so many different cultures, and I think we should always be learning and always trying to upskill. And I'm going to shut up now, and that's because I'd go on now, you know me, Louise, so I'll be quiet and see what next thing you want to ask me.
That's really helpful though, to get that sense of what's in the toolkit. I know it's been shared in the Q&A for people to access. I know AkiDwA have one as well, and that's really, that sort of model, using the term diverse is a really helpful way to really simply show all the different aspects for people to consider. And as you say, it seems to bring together very practically a lot of the themes and really important factors that support the quality, not just access and engagement, but the quality of the engagement with mental health supports and services for people from a migrant background or ethnic minority community. So I'd encourage everyone to have a browse of that. So then, in terms of, I guess we've been talking a lot about what mental health professionals can do as individuals and in their practice. In terms of service responses, what do you think most needs to happen within mental health services to better meet the needs of migrant women in particular?
I think the access to interpreters, and not just access to interpreters, but also clear and communications, accessible communication, is a big thing. So we did regional roadshows with the HSE's Mental Health Engagement and Recovery Office this year. We were in Kilkenny, Cork, Maynooth and Sligo, and I was bringing printed copies of these to each of them. And a lot of the people attending were either working on frontline HSE, mental health services, peer support workers, family support workers. And of all the materials I brought everywhere, these were snapped up, and everyone was speaking to me about how glad they were that I had, you know, brought them. And I know it's available on the website, and they've been sent around, and the ethnic minority guidelines get sent around by the Mental Health Commission to different inpatient centres and that as well. But I think sometimes it's nice when you actually, you know, you have the physical, or maybe I'm just old, maybe that's just my age, I like the physical copy of it. So the reception from people in all of those locations around Ireland was really, really positive. They thought they could see the importance of it. They could see the need for it. They've all come into contact in their services or in their communities of people that either needed access to interpreters or, you know, more accessible communication. So I think that the appetite is there. There's also, on a policy level, and this is one of those things where, you know, unless you're kind of looking at the government website to see, you know, what open consultations are there that I can send in, and that's part of our jobs in the policy groups and in the NGOs is, you know, there's the Women's Health Task Force. People have been sending in submissions to them. There's the Citizens Assembly on Gender Equality. You know, obviously the likes of AkiDwA and others send in submissions all the time. So over, particularly I would think in the last number of years, there has been, so we have a national strategy on domestic, sexual and gender-based violence. We have the Connecting for Life, so the National Office of Suicide Prevention. There's a national strategy for women and girls as well. So there's lots of work been done in the area of women's mental health. And I think just at this point as well to say, you know, just to note that that would be, you know, gender specific people who might identify as women as well, because there is that intersectionality of, you know, you could be a member of the LGBTQI plus community and a migrant person as well, and trying to access different services. So yeah, there's the stuff, the kind of practical stuff on the ground as well is apparently migrant women are more likely to live in overcrowding in houses and have higher rates of unemployment as well in the country. So even if you're thinking about access to supports and services, you know, if we're saying, oh, well, there's a helpline and you can call up. If you're in an overcrowded housing place, or like that childcare was brought up earlier, where are you going to get the privacy to make a phone call? And that's even if you are, you know, in your culture that you do want to I'm sorry, is it really loud here in the background? Sorry.
No, it's not.
Okay. You know, so there's all of those kind of things as well, that if you do want to access support, how you might do that and the different ways that you can do that. And I think the point as well that Caroline or Liliana made about access to tablets and smartphones and things like that for the children during COVID and school, like there was a big switch to e-mental health, digital mental health, which is great, absolutely great. If you have the internet at home and you have access to, you know, you have the laptop or you have your smartphone or whatever it is. So one of the pieces we're actually doing in mental health reform is looking at the digital divide. So if there is anyone here today who's tuned in, it will be great for them to get in touch with us so we can speak, because, you know, it's that thing of like, what voices aren't at the table. And sorry, just to say, in my policy geekiness as well, I know there was the piece earlier this week about perinatal mental health and the really awful outcomes for migrant women in Ireland still, you know, that we have to address. But the Economic and Social Research Institute, ESRI, the day before that had also released a paper on, it was Migrant Women in Ireland face double disadvantage. So you're a woman and you're a migrant. So about how all, you know, so many cards are stacked against you. And it was a really interesting read as well about just practical things that we can be doing and things that can be taken into account in government policy and national policy. But I really like Caroline's point about we can't just say like, oh, go and get counselling and go for talk therapies. You know, you have to talk to the person and see what is it that's going to make a difference to them and their lives, and what is the support that they need. I know we've been involved in some of the Ukrainian response, emergency response fora by the government, and that was something that came up in discussions around mental health, that in Ukraine, there is stigma around access and counselling and talk therapies. So again, like we can say, oh, here's 6 free sessions for everyone, but if that's not going to be what's needed and what's going to make a tangible difference, and that, again, listening to people will make the difference, and actually listening to what they need and what they want.
Absolutely. They're fantastic overview of, I guess, great policy initiatives that are in train, but also maybe more targeted and practical and nuanced, again, considerations around stigma and making maybe certain presumptions about people's readiness to approach mental health services, etc., and how information is provided and all those. I think that's really helpful, and also great to hear there's been such positive engagement and response to the cultural competency toolkit. So thank you so much for that. What we're going to do now is take a 5-minute comfort break. So we'll invite people to come back at about 11:05, and then we will be speaking with Justyna Maslanka, and we will then open up to a group discussion to finish us off, and please add your questions into the Q&A for that. So we'll see you in 5 minutes. Hi again, everybody. I hope you were able to stretch your legs or step away and take a break and get some refreshment for a couple of minutes. We will be going on till just around past, so hopefully you can stay with us for the remainder. So our final speaker joining us this morning is Justyna Maslanka, who I had the pleasure to meet only a couple of weeks ago at a mental health reform event. And we're especially grateful for Justyna's openness to taking part this morning in the conversation at limited notice. Justyna is an expert by experience as a mental health service user and a migrant woman, and she volunteers with Cairde's Mental Health and Wellbeing project. Cairde, for anyone who is unfamiliar, is a community development organisation working to tackle health inequalities among ethnic minority communities. I know they have a wealth of resources and information available on their website. I had some difficulty accessing them this morning, but that may have been a temporary website problem. Justyna is also a member of Mental Health Reform's Grassroots Forum, and has participated in the development of their cultural competence toolkit, as Burr mentioned earlier, and is also a member of the implementation monitoring group for Sharing the Vision. So a very busy woman. Justyna, thank you so much for joining us. You're very welcome. You can unmute there. Beautiful fan in the background. You have the nicest background, I think, this morning.
So, good morning, everyone. Thank you very much for inviting me for this meeting, for this event. I'm very grateful, just technical, I got it. So I'm very grateful for to be with you guys here, and thank you very much for kind words and a fantastic presentation, ladies before me. That was very helpful for my knowledge, for my experience, for the future. And I'm very happy to be with you and share my experience, my knowledge, what we're doing in Cairde and how we're supporting people by mental health difficulties.
Thanks so much, Justyna. Can you tell us a bit more about the work you do on mental health with Cairde? That'd be a good place to start.
Yes, so this time I'll try to be a little bit shortly.
No problem.
Because the time. So Cairde works with ethnic and minorities in the area of health. Cairde Mental Health and Wellbeing project focuses on community-based mental health promotion and improving access to the services for people experiencing mental health issues in different nationality, ethnic and minorities group. I have contributed to the development of pathways to being well-resourced back for ethnic minorities and to the development of peer support and advocacy model in mental health and well-being for ethnic minorities group in Ireland. I do outreach with Polish and other nationality migrant communities and support individuals struggling with mental health issues. I have them emotional support, giving them emotional support, information, signpost to the mental health service and other services. Support with practical issues, inform about rights, patient rights, human rights, about the procedure in the mental health service, and treatment and advocate if needs be for people. I also engage with mental health commission with mental health reform, hello Bear, and other like mental health tribunal and other engages to raise awareness about migrant issues and cultural differences, languages, and other issues of life.
Okay, so a huge range of work going on, and it sounds like there's a mix of kind of practical support and emotional support, but also that advocacy piece is so important in terms of making sure the needs of migrant women are heard. From your own work and experiences, are there any thoughts or comments you'd like to add on the conversation so far? Has anything stood out to you in particular?
Yes, I'm being resilience takes me time. So I'm actually, by my own experience with mental health service, and I decided after my trauma, after my recovery, I decided to take part to fight about myself, to change my life, to do something good in my life. I started doing properly self-care. I'm invested in myself, go to yoga class, go to gym, go to cultural center like museum, musical center, to the National Gallery Hall. I'm close to the natura with animals, just enjoy the life. I started eating well, so I changed diet for vegetarian. So I'm doing something good for myself, like 1 day per week spa, a home for myself for relax, glass of wine, and bathroom. It's
fabulous.
So meditation and love myself, just make my home like sanctuary. So just, like crystals, something energy from Mother Earth, which make me comfortably and putting more lights, more sunshine to home. So because it's important where you live for mental health as well. Involvement with mental health, it let me give meaning to my experience, learn more about mental health, learn about myself, and accepting that this issue that I'm on mental health, and which was very hard to accepting, and start live with this and understand actually what happened to me and what I can do good with this for other people. So I met wonderful people in my recovery time, and later on when I'm engaged with other organizations, which I'm fantastic people. I'm learning from them a lot. We did fantastic project for other people and services. I can help others at the moment and support people as I can, and because I share knowledge from others, which I learn, and my own experience, to provide more professional advocacy and service for people with mental health difficulties. This let lift the stigma of mental health condition. So that this impact, which I am actually access to the services, to the organizations, and self-care, that actually helped me to live in the past time, my stigma, and just enjoy life now and doing something for the future.
Absolutely, that's a really positive message, and thank you for we've talked about resilience, and it's come up as a theme through all the speakers, but you gave such a lovely description of what works for you, and thank you for sharing your own personal stories and tips as well that will benefit other people. And stigma is something that I might actually come back to when we have all the panel together. I know you'd mentioned to me previously that you're eager in Cairde and in the work you do with people there to get more women engaged. Is that right?
Yes. So at the moment, we're looking for more women who are actually interested to work with us voluntarily in that project and for Cairde, because we're working in our group with different nationality and different languages, and we want to have access to all communities, ethnic and minorities group in Ireland. So if anyone is interested about collaboration with us and support Cairde and our project, so please contact Emilia Marchalewska at Cairde. We very welcome at the moment, I know we're looking for Somalian lady because we have no experience with this language. And we very welcome this more community, Chinese community. And I know we have fantastic ladies in our group. We're speaking in 9 different languages.
Wow.
So we're supporting Ukrainian people as well. We have project like providing service and support to mental health advocacy and interpreters for Ukrainian people specific and for other ethnic and minorities group.
Brilliant. That's great, Justyna. Thank you so much. And what we can do as well is, well, we can spread the word today, but we'll also include it in our newsletter that people who might want to get involved can get in touch with Amelia in Cairde. Thank you so much for sharing your time with us. I'm going to ask you to stay there, and I'm going to invite Liliana Burr.
I'm delighted to be here and take part in this project and share my experience. And thank you very much.
Thank you very much. We really appreciate it. And I'll invite Burr and Caroline and Liliana to join us now as well. You can share your cameras, and we'll change to gallery view if somebody can do that, Elaine or Faye, so participants can see everybody. So we have time for a few questions before we start. I know there is one question I'll get to in a moment, but one thing I wanted to start off with is something that's been mentioned by everybody, which is stigma, and how it maybe needs to be approached in nuanced ways and sensitive ways. And I wondered if anybody had any comments on thoughts about what services and professionals can do or need to be mindful of in approaching that and trying to break that down for women who may need mental health support. I don't know if anybody in particular wants to have a go at answering that.
I think I would go back to what Caroline was saying about the language. That is very important. And to what she and I were saying about the way of being when we work with the person. So cultural humility is also about a way of being, not assuming that we know everything, not assuming that we understand everything. I could work with, like Justyna mentioned, a Somali population. I work with Somali people, but I could work with 100 people, and I cannot assume that the next one I'm going to see is the same as the one I saw before. Everyone is different. Everyone has a very different context and upbringing, and because culturally mental health is understood in different ways. We also need to speak with our clients and ask them. We learn so much from our clients. Let's ask them, what does it mean for you to go to psychology? What does psychology or psychiatry mean in your culture? Did you know that you were referred? I ask a lot, did you know that you were referred to psychology? People didn't know. Even though they give consent, they probably said yes, but they didn't know, and then they didn't understand. And then we need to explain to people what is psychology and what can we do. And some people say, look, I don't want to talk. And some people say, oh yeah. And it feels easier to speak to a stranger sometimes, like me, rather than speaking to somebody they know, because of the stigma and some things that can be shared, some things could bring shame on them. So I think, again, going back to us as practitioners, our own education, our own training, and our own self-awareness as well, and the language, like Caroline was saying.
Okay, thank you, Liliana. I can see Caroline nodding there. Burr, do you want to come in there? I can see your hand up.
Yeah, I was just going to say as well, I think funding the community and voluntary sector organisations, the NGOs, like Cairde, AkiDwA, people with lived experience, people directly affected, giving funding to them as well as just to, the HSE or the state supports. I think that's really important. And it's something, if I know Faye has just shared our link there, it's something we call for in our pre-budget submission as well. You're on mute. Our first one of the morning, Louise, you're on mute. I think you were calling Justyna in there, though.
I pressed the wrong button. Sorry about that. Sorry, Justyna, I can see your hands up there. Go fire away. You can just unmute. Perfect.
Hi again. Sorry, I was on mute. Thank you very much for giving me voice. Based on trauma, we have to pay attention that it's difficult. Trauma is difficult for everyone, every culture, people. Is because it's barrier of culture, barrier of languages, different understanding of mental health in different country, different culture. And the trauma is not just, it's different, you know. We have in service ladies from Palestine, they have trauma from life because the politicians' situation in the country. And many people like refugees, Ukrainian people who actually have a war in the country, they lost everything. They have trauma, strong trauma. Trauma with people who have mental health experiences with admission to the hospital by violence at home, but sexual violence, abuse, women's usually. It's many different trauma of life, but it's the key is that people has to understand and trust to the psychologist doctor who listened and heard the person and understand, who built the trust, belief, and the great communication, support people and give provide the access to the other services, which therapy in any activities. It's helpful people. And important is for people with mental health difficulties to understand that your life is going to change, and change the value on your life, and accept that you have the mental health illness, that you have to take medications to feel better, to feel good, and you're not marginalized. You important as well. Everyone is important, and everyone have a choice to find new job, to back to normal, to go at the gym, do any activities, you know, and care. Important is actually to inform people and provide information how to change the stigma and start leave that on the past time and understand the way as the person are and how to become to the future, to change, you know, because some people, they still in the stigma and they long time and they have no support. Nobody explained them. I'm doing holistic therapy for people as well. So try giving the light in the dark road to the people and give them brief which choice they have, with you know what they can achieve in life, that they important. And because usually it's problem that family are actually not supporting people, they discriminated, they marginalize people, they don't care. So person with mental health difficulties usually is alone. In Ireland, we have plenty migrant people who have no family, no friends, they're completely alone. And it's not too many community services who provide like free classes, you know, like where people coming to that class, like yoga class, cooking class, any courses, you know, or gym. So it's community and people meet other people, find friends, and feel like when I attended at the gym and did yoga, I feel more confidential with my body. I learn my body myself. I start love myself. I understand that I'm important as well. And I just understand that I have to leave the past time that's just gone and start take the life by full hands with open heart, you know, and just enjoy and doing something for other people. And everyone can do this, you know, but they need professional support.
Okay.
And we need interpreters, but important is to understand this person and provide the service like professional with trust, with hearing and understanding, you know, it's very important. It's not just like, because I'm doctor, I'm listening to you and okay, give you medication, prescription. Hi, how are you? Oh, good, thank you, bye. No, that doesn't work anymore.
Right.
That is completely bad.
So it comes back to the themes about being holistic that Caroline mentioned, about all the different contexts, the idea of humility. You had so many beautiful ways of phrasing it there. I really like the, you said being the light in the dark road for people, which is such a beautiful term. And you brought up trauma there, and I'm conscious one of the questions that has been raised, if it's okay to bring that up. Thank you so much, Justyna.
Thank you very much.
A participant has expressed the view that refugees are at risk of post-traumatic stress disorders with mental health services, and that this needs attention as well as focusing on cultural issues. I wonder, does anyone have any comments to speak to that around risk of post-traumatic stress disorder? And I think it's about adopting, I'm not 100% sure on the question, but I think it's about sort of recognizing maybe higher risk for certain mental health difficulties and making sure that there's mental health service responses in place for that. I don't know if anyone has any thoughts on that.
Thank you, Louise. I just wanted to look at I'll try to be very, very brief as at PTSD as something which can present in so many ways, and without even diagnosing. Again, I want to go to that place of holistic, looking at so many factors, how some things are understood in certain cultural contexts and backgrounds where the people are coming from. So sometimes not unless you have this picture, because like here we know that women who have gone through FGM, for example, this is something they suffer from, but how does it present itself so that it can be handled in a certain way, even by the therapists where we said them. So there's that long road even to diagnosing and then dealing with it, and the questions you ask and how you ask them, and also learning, because even someone might be in denial. You're there, it is happening, yes, but someone may be saying, no, that is not what happens. It's because there are these spirits who are attacking me. Maybe they attack me at night, even how to live, and other things like panic attacks, because some people may not have words where they come from for all those, all that. So I want to say that it's a long road. Again, it requires, I know Njiro is here. She's the head of Black therapists. So it requires a lot of talk. It's a slow journey, so to speak. And I think I'll stop there so that someone else can say something. Thank you.
Thank you so much. And I think AkiDwA actually has asked a question, and we've shared some information about Black Therapists Ireland in the Q&A as well, and we'll include that in the newsletter for people. Liliana, I'll come to you, and then I'm conscious of time, so we might need to wrap up then. So I can see your hand is up there.
Thank you. I think we need to talk about intersectionality, because refugees and asylum seekers wouldn't have higher risk of PTSD if they were not refugees and asylum seekers, if they hadn't had to leave their country. And refugees and asylum seekers come from a culturally and linguistically diverse population. So we need to talk about the two things. We need to talk about the risk of PTSD, and we need to talk about their culture and how were they brought up, and what were the pressures and the systems in their culture, and how they are getting on here when they're living in the Irish culture. So, we can talk about a very medical model where things are treated with medication, like Justyna was saying, but we can also talk about a model where we look at more complex issues, where we accept and understand that if somebody comes from a very difficult situation, at the beginning is going to be feeling unwell, It's going to be not sleeping, being distressed, upset. Of course, we need to keep an eye on that. And then if we need to diagnose, we diagnose. But there's a particular criteria for diagnosis. So at the beginning, we need to understand that people may present with normal reactions from abnormal circumstances, which is, forcibly displacement or war and all of that. So it is a very broad issue, really, but we need to talk about the two things: the culture, and intersectionality with the mental health presentation.
You can see lots of nodding heads there, absolutely. So really important to recognize that intersection and of gender, of course, as well. Justyna, is that your hand up from previously, or did you have a oh, it is. Okay, I wasn't sure. I didn't want to see if you had any final comments. So thank you all so much for joining today. I'm incredibly grateful to our panel for giving their time. I know they're all exceptionally busy women: Justyna Maslanka, Grogan, Liliana Morales, and Dr. Caroline Munie. And we've shared different links to organizations in the Q&A, and we'll make them available for the network too. And thank you all for your comments and questions in the Q&A. I'm going to hand over to Faye to close us out, and I wish everybody a lovely rest of your day and weekend.
Thank you. Have a lovely day and weekend. Bye.
Bye-bye.
Thanks, Louise. And just to say thanks again for, Justyna, Caroline, Liliana, and Bear for giving up your time, and particularly Justyna for you sharing your experiences in such a positive way, and, sharing a lot of really practical things that I think all of us can learn from, whether you're a practitioner or working in policy, or, just at a human level, things that we can do day to day. So thank you for that. And thanks, Louise, for doing such a good job hosting, as always. So just, I don't have much to add to that, but I think on the cultural competence point that was raised many times, I think just to highlight, as Caroline said, you could never know everything, and that just to reiterate that it's an ongoing process. Cultural competence should not be a once-off event or a once-off training. It really should be an ongoing process. So for services out there, if there's any services managers, just to keep that in mind for your own service. So the recording of this will be going up on the National Women's Council's YouTube channel later today. We'll also be sharing it via the newsletter, along with anything that was mentioned today. If there's any additional things that people in the audience didn't get to bring up, or things they might come across over the next few days, you can give me an email. It's fayw@nwci.ie. And we're always open to hearing more about your work, the work that the network members are doing, and things that you're interested in. And finally, if you're not a member of the network, why not? It's free. We have great events like this, so I'll send out a link to everybody here to sign up. It's just a quick form. So I think that's it for everything. So thank you so much again for everybody who took part, and for everybody for attending this morning. Thanks a million. Have a great weekend.
Thank you.
Thank you for having us. Bye.
Bye, everyone. Thanks so much.
Bye.